everyone. I think everybody are in pink of your health. Today the topic of discussion is the ribs. I have already discussed the video of the thoracic vertebrae. Now the ribs, you will see these are the elastic arches of bone. And these elastic arches of bone, you will look this one, it has got two ends, the posterior end, the anterior end, and these two ends are connected by intervening portion that is known as the shaft. Now in our body there are 12 pairs of ribs, and that is connected with the corresponding thoracic vertebrae, and you will see these ribs, the posterior end, the head, it bears two demifacet. You will see here, this is one demifacet and there is another large demifacet, and this constitute the head. And you will see in between this demifacet there is an elevated area which is known as the intra-articular area, and this gives attachment to a ligament. Next you will see next to the head, the rough area, it forms the actually the neck of the posterior end. Now this neck is rough for the ligamentous attachment at the transverse process, that is the posterior costotransverse ligament. Next, the neck, the superior part of the neck is elevated above, and this is known as the crest of the neck. And you will see behind the neck you will get an elevated area which is known as tubercle. Now this tubercle has got an articular part and it has got a non-articular part. The articular part articulates with the same number of the ribs. Suppose this is the fifth rib, it will articulate with the transverse process of the fifth thoracic vertebra. Next, so this is the different parts, and the rough part gives attachment to the costotransverse ligament. Next is the anterior end. You see the anterior end is hollow, cup-shaped hollow, and here the costal cartilages are attached. You see our thoracic cage is very malleable, because, and we will take advantage to this malleable nature of the thoracic cage, because when there is stoppage of the heart, then there is cardiac massage is given through this due to the elastic nature of this thoracic rib. Next is that you will see this cup-shaped depression articulate with the costal cartilage, and according to the attachment to the sternum, these ribs may be classified as the vertebrochondral ribs. That means through the costal cartilage it is attached to the sternum in the midline. Vertebrochondral ribs, that means the cartilage is attached above, and that will form the vertebrochondral rib. And next is the last two, they are the floating ribs or known as the vertebral ribs. So this is one type of classification. Another classification is the typical rib and atypical rib. Now you see the typical rib are from 3rd to 10th, they are the typical rib. They bear the common features, that's why they are known as the typical. So next I will show you in the shaft, you will see on the inner surface of the shaft there is a groove on the inner aspect, and these grooves, through this groove passes actually the artery, vein and the nerve. So this is the situation in the costal groove. The vein is above, then the artery, and then is the nerve. So this is the location of the intercostal vessels. And these intercostal vessels are covered by muscle, which is the innermost intercostal muscle of the thorax. Now in the thorax there are three pairs of intercostal muscles. One are the external intercostal on the outside, internal intercostal in the middle, and the intercostalis intimi lies on the inner aspect. So in between the two ribs you will see there is a space, and this space is covered by this muscle, and this is known as the intercostal space. And that's why breathing is possible for these intercostal muscles, and there is expansion of the chest. So this is the typical rib. How will you hold the typical rib in anatomical position? You will hold the rib in such a way that anterior end, which is identified by the cup-shaped depression, and posterior end by the head, neck and the tubercle. So you place the anterior end below than the posterior end, because the ribs gradually it becomes oblique in nature, and the middle rib they are most oblique. So this is about the typical rib. Next, the false rib, or that is the atypical rib. You see, this is the first one. What is the difference? You will see the typical one, this size is the smallest size. It is most curved. You will see here the inner border, and you will see the outer border here. And you will see, in spite of internal surface and the external surface, like the typical rib, this is the external surface, this is the internal surface. There is no internal and external surface. You will see here, this is the superior surface and this is the inferior surface. How you will identify the superior surface? In the superior surface you will get two groups and a ridge. Now the two groups, it lodges, anterior group it lodges the subclavian vein, and this posterior group it lodges the subclavian artery. And in the border, that is the inner border of this first rib, it gives attachment to a fascia which is known as Sifton fascia or suprapleural membrane. So this is very important. And in the middle of this inner border there is a tubercle that is known as the scalene tubercle. Here a small muscle of the neck is attached which differentiate the vein in front and the artery behind. And the outer border on the posterior aspect is very rough. So this is the anatomical position of the first rib, and there is no costal groove here, and there is no attachment of the superior costotransverse ligament. You will see the angle and the tubercle, they blend in the same place, and there is a single articular facet in the head of the first rib. So this is the first rib. Next you will see the second rib. The second rib is twice that length of the first rib, you will see. So the second rib is the twice the length of the first rib, and it has got two facets at the head, and you will see there is a slight posterior angle. This is the tubercle. The posterior angle in case of typical one, this is the tubercle and this is the posterior angle. So there is much difference. So this is the second rib, and there is slight costal groove you will see here. So this is the second rib, and it has got similarly the outer surface which is more convex and present externally, and inner surface it present internally. Next is the 11th rib. That means that is attached, that is the floating rib, and you see how will you hold this bone in anatomical position. In the head there is only one facet. The tip is tapering tip, you will see the tip is tapering. The superior border is actually not thickened like the typical rib, it is very thin, and it gradually goes down, and you should hold the bone in such a way that this internal surface is slightly facing upward. So this is the 11th rib. Next is the 12th rib. Not in small all skeleton the 12th rib is so small, but this one is so small. So you will see the 12th one, it has got similarly only one facet, there is no angle, and this 12th rib is very important because its medial part gives attachment to a muscle which is known as the quadratus lumborum, which fixes this rib so that diaphragm gland moves up and down during respiration. So this is about the ribs. Now the clinical anatomy of the ribs. Suppose there is the fracture of single rib. It is very often occurs. Suppose a muscle man embraces you tightly, then one have got the rib fracture. Or in case of old age, when the ribs become very brittle, continuous cuffing, it produces fracture of the rib, and there is a chest pain. Next, in the vehicle accident, you will see the few portion of the ribs become fractured. So what will happen? If the few portion of the rib is fractured, say this segment acts as a fail. Fail means when there is inspiration, then this fail segment goes inside, in spite of goes outside. And when there is expiration, this segment goes outside instead of going inside. So there is the paradoxical respiration. So this is about the ribs. Thank you everyone.